Welcome to my podcast. Today, I'm here to answer questions about your oral health and what you can do to prevent the dreaded word that is the cancer of the oral health. To discuss with me, I have Dr. Anish Ganguly, who is an oral facial-maxillary surgeon. He has worked in Tata Cancer Hospital in Mumbai, and he's here to share his insights into the oral cavity with us. So welcome, Dr. Anish.
Thank you, ma'am. Thank you for inviting me today. I would be discussing about the oral cancer problem in India.
So you are from which state, Dr. Anish?
I hail from Assam, Guwahati.
Right.
It is one of the cancer capital of the country. Yes.
And so you must have seen a lot of cases of cancer because I think they eat betel nuts and all that?
Absolutely. The problem of oral cancer arises mostly because of the smokeless tobacco. That is in the form of pan, gutka, and other like the betel nut, which is very common in the northeast region, areca nut, and in Meghalaya, if you're aware, they call it kwai. So all this leads to oral cancer. And the problem also arises when, due to the culture, a lot of people start at a very young age.
Right.
Most of the time I've seen in Northeast that some of them, they start from the adolescent age itself.
I think younger than that.
Yes.
Right.
Yes, we are trying to have a meeting going on with the school principals and all. Government is also helping with the drive. So we are trying to reduce that, at least schools and all should be no tobacco zones.
Right.
Maybe that will help.
So tell me, like, as a young boy, you must have seen a lot of these cases happening, and I know your parents are doctors as well.
Yes.
So what really interested you and drove you towards this field? Because you could have done anything in your field, but what made you become a maxillofacial surgeon? What was the motive behind it all?
Well, to start it off, because like both my parents are doctors and dad is a general surgeon and mom's a gynecology. Maybe somewhere deep down that surgery thing was always inside. But it didn't come out till I started dentistry. And once I entered the field of dentistry, I realized that the dentists are the frontiers for the oral health.
Right.
And as the studies advanced, most probably the inclination towards surgery increased. And thus one thing led to another and I've joined maxillofacial. And eventually, because Northeast being the cancer capital, so I thought, yes, this is the best place to serve. And hence.
So what would you advise our audience? Give us 5 reasons why they could have oral cancer, or they could, they could be these things that they eat or drink or smoke. So what are those things? What should they avoid, or what should they be very careful while consuming?
Well, we all know that prevention is always better than cure. So oral cancer especially, it's not that आपने गुटखा खाया तो एक दिन immediately cancer हो गया. The body will show certain telltale signs, like there are precancerous lesions.
Right.
A person who is having gutka and all will eventually have those fibrosis, which we call it oral submucous fibrosis. So that becomes an incidence जहाँ पे a patient will have a higher incidence of having a oral cancer eventually in the future.
So, wait, I'm going to hold you there. What is the fibrosis? What happens? What are the symptoms?
Basically, the easiest way to detect is the patient will have reduced mouth opening.
Yes.
So these are very basic, simple steps. People can also do it in their homes.
So when you say reduced, what does the reduced mean?
Basically, any person who has a 4 centimeter above mouth opening, like a 4 fingers you can say, has a natural way of opening their mouth. But when the fibrosis occurs, that fingers will reduce to maybe 3 to 4, 2, and gradually it will have difficulties in.
So tell me, are they more susceptible to the sense of spices, the chili?
Yes, certain patients do have burning sensations slightly enhanced than normal people.
Right.
It also leads to, even in tongue cases also we've seen, burning sensation do have a telltale sign. Yes.
So you are telling me that if someone has a fibrosis, can't open their mouth, like when you can open or you can't open, right? So if you can't open your mouth, if you are having chilies and you're feeling the sensation of spices and burning a little too much, it's time to take stock and visit your doctor?
Absolutely.
So what would you then look at as a doctor?
Well, first and foremost, I always recommend all my patients to at least visit the dental clinic twice at least in a year. That becomes the screening, the baseline. If in those screenings we see that the patient is having some habit, it's always better to give them counseling and stop the habit then and there, nip the bud.
So what habits? You didn't tell us that. I wanted to know what habits they were. Very, very important thing.
So habits are like basically because of the stress and all, a lot of people do end up falling for smoking. Smoking is quite common. It's not just like we say ना कि गुटखा ठीक है एक सोशो इकोनॉमिक बैकग्राउंड पे है. Smoking is for everyone. Everybody is smoking. A lot of people, some of them they have become purist. They prefer कि tobacco roll करके करेंगे like the old generations. But ultimately they all are harmful. So they need to have to find other ways to tackle stress, and smoking is not the answer.
So number one is smoking.
Yes.
And number two I can see is stress.
Absolutely.
Number three is the areca nuts that you've talked about.
Yes.
And any other reason?
Yes, there are a few incidents where a sharp tooth which has a continuous trauma in the buccal mucosa or any other places can tend to a constant trauma can lead to cancer as well.
So people are fearing root canals nowadays. Because they don't want to come to a person like you, right? They can't choose a specialist. So what is your take on that?
Well, to be on root canals, I've heard about it a lot, but I would say that root canals are not exactly the reasons for oral cancer. Poor oral hygiene is.
Right.
And in India, we do see a lot of people getting their root canals done from non-dentists. Like we do have a lot of quacks going on in the country, and when they do it, they might harbor infections, maybe, but these are all ifs and buts. So I do not say that root canals can cause cancer.
Right.
Poor oral hygiene definitely can.
Right. So now coming with their hygiene, how many times do you expect a person to brush? Because a dentist is like, oh my God, you have to keep brushing, right?
Absolutely.
Before or after every meal and things like that. But
True.
Logically speaking, how many times should a person brush?
Twice a day is fine enough.
Okay.
Yes.
So you talked about the brushing, oral hygiene.
Yes.
So how many times does a person need to brush?
Twice a day is fine enough.
It's good enough for
Yes,
oral
it's good
hygiene?
enough. Absolutely.
Okay. And what about if they have cavities and they don't fix it? Because not everyone can go to a dentist, So
Well, they should. India does have a lot of dentists. If they find that privates are expensive, they do have the standard government institutions. They do it in a very cheap, and most of them they do it for free.
Right.
Dentistry is not out of reach for the Indian population.
Right. So that's a really good thing. If, we can all afford dental care, then I do think that should be a part of, our regime to look after ourselves.
Absolutely.
Now I'm coming to the most interesting question. So you get a case. And that case hasn't really progressed, and you know that you have to maybe do some surgery. Okay. Either it could be the tongue or it could be the gums, anything. So how difficult is that surgery? Not for you, for the patient. For you, I know you have your expertise, so you'll do it. But what about the patient?
Well, any sort of a cancer surgery is a life-changing procedure.
Okay.
No, but it's very difficult to say that the life is going to be the same after the surgery. If the case is quite big, depending on the location as well and the extent of surgery, the patient will have certain difficulties in the speech and swallow.
I see.
Appearances also might change.
Right.
So they have to live with it. So those things are always something we like to counsel our patients before we start those cases. It's very important patient is aware. That's why there is always a department which focuses on prevention.
Right.
Yes.
So prevention is definitely better than the cure,
Absolutely.
so as to speak.
Especially in oral cancer, prevention is always better than the cure.
So when you operate, how long does it take for the patient's recovery, keeping in mind that it's the buccal mucosa and there's saliva and there's, you have to eat and things like that. So when can a person eat? When can the person speak? So what is a patient going to expect?
Again, it comes down to the extent of surgeries. If we are doing a T1, T2 lesion, with minimal flap surgeries, we would still wait for a month or so.
Okay.
Yes, and even if for the flap surgeries, if they are doing a free flap surgeries or a local flap surgeries, so we do see a waiting period of at least 6 to 7, 8 weeks.
So what happens then? They have food through what?
We do put a Ryle's tube through the nose. Yes.
Oh.
That becomes
But it's
difficult.
okay, at least the nutrition is happening and the patient can recover.
Nothing beats the good old-fashioned oral feeding. The Ryle's tube compromises a lot in the nutritions. Everything is filtered, the fibers are not up to the mark.
So I understand that nothing is better than eating on your own. But having said that, it's people like you, doctors like you, who actually can help these patients who would have otherwise had a very, very bad outcome.
Absolutely.
At least live and move on and be functional. So I'd like to thank you for coming on our podcast.
Thank you, ma'am.
And hope and wish you all the best.
Thank you so much. Thank you so much for inviting me.
So thank you everyone. If you have any questions, please write to me.